I'm Jessica Stern. I'm the Executive Director of OutRight Action International. We're a 30-year-old global LGBTIQ human rights organization with staff and offices in 9 countries around the world. And we're really happy to talk about the ways LGBTIQ people have been impacted by COVID.
My name's Julie Polerwitz. I'm the director of the HIV program at the Population Council. And the Population Council has been in existence for about 65 years now, with the main goal of improving programs and policy around HIV and many other health and development issues by generating evidence and providing evidence-based programming. I'm joined by colleagues who are based in Nigeria, Elizabeth Shoyemi, who has been leading our clinic-based work in Lagos, as well as our Nigerian country director, Adebola Adedemeji, and our support team member, Isabel Levinson, based in New York, who helps with our communications and other sharing of our results.
I'd like to maybe start with you, Jessica. Like the Elton John AIDS Foundation, OutRight was in a position to pivot quite quickly and help support a whole host of unmet needs in the LGBT community. And our emergency fund worked to sustain gains in the HIV response for LGBT and for people who use drugs and sex workers. But can you talk a little bit about what was the impetus behind OutRight's decision to organize an emergency fund? And what impact do you think that's had on the people that you've reached?
OutRight has a history of doing quick organizing in times of emergency, whether it's natural disaster, war, or other kinds of crisis impacting the LGBTIQ community. And one of the things that we've seen is that when natural disaster strikes, those who were most vulnerable before the crisis are most vulnerable during the crisis. I joined the organization in 2010, just after the tragic earthquake that hit Port-au-Prince, Haiti. And what we saw then was that while everyone was suffering from the earthquake, there were some saying it was God's wrath punishing the island for the creation of LGBTIQ organizations. And so what we know from historical record is that unfortunately, LGBTIQ people get blamed in times of crisis, and they also fall through the cracks of emergency response mechanisms. The government and conservative-leaning religious organizations are not only not friends to LGBTIQ people, they can actually be a part of the problem. And so we set out to do something about it very early on. We created an emergency fund, and I have to be honest and I say, when we started building the fund, we knew it was the right thing to do, but we did not know if we would manage to raise funds in a time of global crisis. I'm happy to say that we were very successful, and it's enabled us to give, as of this morning, 117 grants across over 63 countries to LGBTIQ groups on the front line. We accepted applications for 3 weeks only, and in 3 weeks, we received over 1,500 emergency appeals. So it was mind-boggling when we saw the amount of need. And then we looked at what the categories of needs were, and what we found was really quite upsetting. 55% of the applications that came into OutRight's COVID emergency fund were for emergency food relief. And that was a data point I never, ever could have expected. And what it showed was that LGBTIQ people were living on the razor's edge of poverty before the pandemic. And so, of course, when countries' economies shut down and people weren't able to go to work, there were no resources. We were able to support food distribution, reaching more than 50,000 people worldwide. If there's something I could say about what we've learned and where to go from here, it's that humanitarian agencies and humanitarian institutions within government need to queer their response to make sure that LGBTIQ people are receiving the support they need.
As an organization that's based in the States, what gave you comfort, and how did you make sure that the money reached where it was meant to go and that it was used for what it was designed for?
There's almost $600 million per year for LGBTIQ rights around the world. But then you look at how the resources are distributed. 300 million of that, so literally half of all of the money for LGBTIQ rights globally, stays within North America. It goes to support LGBTIQ rights in the US and Canada. I'm based in the US, I'm from the US. I can tell you that homophobia and transphobia still exists here, and we have a long ways to go. But I can also tell you that there are human rights violations experienced by LGBTIQ people in other parts of the world. And while money is not the only solution, money can catalyze progress, because investing in grassroots LGBTIQ organizations mean that they have the money to hire staff and pay rent and have Wi-Fi access and hold community events and lawsuits against discriminatory laws. The US is not always a country that thinks beyond our borders, but I think the data really speaks for itself. We know who is doing excellent work, and we trust community-based organizations because they have the track record. The need is, we all need to care a little bit more about LGBTIQ people around the world. And then who knows, maybe in our lifetime we'll be as successful as eradicating homophobia and transphobia.
What do you hold on to as the things, the difference that you really feel you've made?
This is some of the best work we've ever done, because we literally met people in a life or death moment. I just want to share with you two anecdotes that I think illustrate why this work mattered. So in the Philippines, the smallest unit of local government is called the barangay. And the barangays were distributing emergency food relief during the lockdown so that people would have a way of surviving in spite of not being able to go to work. We interviewed multiple lesbians in the Philippines, and they would go to the barangay and they would say, "We're here to get food relief for our families." And they were told, "But you are not a family, so you are not eligible for food." Those stories, they break your heart. And also, if they hadn't had other LGBTIQ organizations to support them, they would have gone hungry, and who knows if they would have survived. And the second story really just sort of, it has stayed with me. Because of the economic consequences of the pandemic, a lot of LGBTIQ people had to move back in with their families, including families that are homophobic or transphobic or otherwise not accepting. And you can imagine that this created a huge amount of anxiety and depression, in some cases suicidal ideation. It's very dangerous to have to deny who you are. There's this one organization, Raise Your Voice St. Lucia in the Caribbean, and they provide mental health services to a broad range of people. And they told OutRight that they got a call from someone seeking mental health services. And they asked, "Are you safe? Are you somewhere where you can talk to us?" And he said, "Well, I'm in my family's home, and my family doesn't accept that I'm gay. So I've gone into the closet so that I can call you where no one can hear or see me." So what we're seeing through this is that people are literally being forced into the closet just to survive the pandemic. We need better for the LGBTIQ community.
Absolutely. Thank you so much for sharing those two powerful stories. A brilliant segue into turning to Population Council, who was recently a recipient of the Foundation's COVID-19 Emergency Fund. So Julie, perhaps you can tell us a bit about the impact that funding has had on your work, what it's enabled you to do.
The Population Council has been working in Nigeria and within an office in Nigeria for decades, working on the HIV epidemic in general and trying to provide services and support to people at need of testing and care and treatment. And about 12 years ago, we started focusing on those who are particularly vulnerable to HIV in Nigeria and in many places around the world. And this is a focus on at-risk men and gay men and other men that have sex with men, and sex workers and their clients. This was a group that was particularly marginalized and hidden and stigmatized, and it took a lot of effort to develop services, both clinic and community-based services, working with the community itself so that the community can feel that there are friendly services and sensitized providers. And so we built this work over time, both thinking about sort of central clinics as well as supporting other private sector and public sector providers to be more sensitive to the HIV and sexual health needs of MSM and other at-risk men. And when the COVID-19 pandemic exploded, we were very concerned that the work that we had built and the resources that we were offering, it would be increasingly difficult for our community to be able to come to the clinic, to be able to access the services. We provide everything from prevention of HIV to testing and treatment, and in particular, stigma reduction services. When this happened, we started thinking about what can we do about risk reduction plans. And so we created these risk mitigation plans for our work so that we can keep our own staff safe as well as keep clients safe. We have been doing some of this work with the support of the Elton John AIDS Foundation, and with the additional support of these emergency funds for COVID-19 specifically, we were able to purchase and provide more personal protective equipment, so that things like masks, things like gloves, so that we can maintain our services, as well as increase things like HIV self-testing kits. So this is a strategy that we've been using to enable people who are unable or reluctant to come to the clinics to get tested for HIV and then to get into access services and treatment. I guess I would turn to Elizabeth, who's been on the ground implementing this work in Lagos. Could you tell us a little bit more about it?
Our clinic, also known as the Community Health and Research Center, is a one-stop shop clinic run by skilled and licensed professionals. The staff are dedicated and provide high-quality services in a friendly and culturally sensitive manner. So far, we have managed 4,000 individuals, 4,000 key populations on antiretroviral therapy, and we have more than 2,000 key populations who are on pre-exposure prophylaxis. Lagos is known as the most populous city in Africa, with over 20 million people, and this overstrained infrastructure and the fact that it is a commercial hub for business with extensive mass transit have created a seamless opportunity for the spread of HIV and now COVID-19. In Nigeria, Lagos State has the highest number of laboratory confirmed COVID-19 cases and attributable COVID-19 deaths and recoveries. Key populations visit the clinic were not willing to come to the facility due to COVID-19, particularly when the lockdown was taken up. So due to fear, due to transportation restrictions and lack of funds to transport to the facility, because of those challenges, the team utilized innovative means to reach the client through virtual spaces, through phone counseling, through expanded mobile clinic outreaches, HIV self-test kit distribution. We also ensured that the COVID-19 precautions were followed, such as the compulsory use of the face masks at the facility. So far, we also reached, during this COVID-19 period, we reached 650 men who have sex with men and 210 female sex workers living with HIV. Total of 1,500 beneficiaries who would ordinarily not want to come to the clinic received HIV test kits. Out of the 1,500 beneficiaries who we distributed self-test kits to, 40 tested positive and were enrolled into treatment. We also enrolled 10 beneficiaries who received the HIV self-testing on pre-exposure prophylaxis.
That's a huge amount that you've been doing in recent months. And when you talk about different population groups, would you say that any one of those populations has been more severely affected? And also, I wonder, are there any individual stories that you could share with us, or your colleagues at Population Council could share with us?
All the key populations were actually disproportionately affected, but those that were most affected were the key populations living with HIV, because when the government announced the lockdown, some of the key populations who lived with HIV could not access their treatment due to the fear of exposure to COVID-19. The situation was particularly challenging for those who were due for viral load testing. So we reached out to all the clients on HIV treatment to visit the clinic for their antiretroviral pickup just before the government activated the lockdown. I want to share a couple of quotes that we received from visitors to our clinic. We are very grateful for the opportunity given to us by the donor to make ends meet and provide for our families in such a trying time. Another beneficiary, I must commend the organizational structure of your clinic. Yours is very welcoming, especially to the community members.
Thank you. Thank you for that. What's really apparent, it seems, in both for OutRight and for Population Council is when you already are trusted by those communities, when you're already delivering services, there are ways in which you can pivot really quickly. I wonder if there's any strong feelings or advice that you could share about how we continue to do both, how we continue to address what we think is coming from COVID-19 and do the really important HIV work.
There are a lot of lessons that can be learned from the HIV experience that we can apply to COVID-19. So, for example, because of our work in communities and with community groups and the links between services and community-based organizations and members, you can think about how we can best reach the community with trusted messengers, with reliable and credible messaging that we're all really struggling with globally. How would we, for example, roll out a vaccine in a way that people feel comfortable accessing a vaccine? So that's a huge lesson from the HIV experience that I think we can apply to COVID-19. Also about community-based programming in general, that we want to bring to the community, things like HIV self-testing and now perhaps COVID-19 testing. So those who are unable or are reluctant to come to services could still get the services they need. And it's important to actually bring services to the community. So it's not only sensitizing providers that are sitting in clinics and satellite clinics and our big center, but also bringing in community members who reach out in different settings to make HIV testing available and perhaps now COVID-19 testing. Lastly, something that is, I think we should never forget is the importance of stigma and discrimination and how that affects people's ability to access services.
When we look at the LGBTQI community, in much of the world, there are certain programs that really focus on their access to services as far as HIV prevention is concerned. And what we often miss is that beyond our concerns about preventing HIV in this community, people also struggle socioeconomically. They struggle with poverty. In most cases, we often ignore that or we don't remember that even after providing antiretrovirals or pre-exposure prophylaxis, people still need to eat. The arrival of COVID has sort of magnified the problems and the challenges that this population has.
One of the things that I really fear is that as community-based organizations try to respond to all of the increased demands placed on us because of the pandemic, that we won't have adequate resources, that we'll be trying to do our core human rights work, our core public health work, and then we're also responding to the crisis. And so if anything, one of the ways that I would see us moving forward is in coalition, like in dialogues like this, but also recognizing that in extraordinary moments like today, we have to respond in extraordinary ways. So one of the things that we've been saying to donors is, this is a time to unrestrict grants to community-based organizations and to make as much available as general operating support as possible. This is not the time to change long-standing grantee relationships. This is the time to let your grantees know we'll stay with you. This is not the time to wait for a rainy day. This is the rainy day.
From the foundation's perspective, in the same way that we want to make sure that every dose of COVID-19 vaccine isn't kind of swallowed up by the global north, because that's not how we'll end this pandemic. We also want to make sure that where the response is available, there's an understanding that everyone is deserving of it, that there aren't some people who are more deserving of it than others. It's so heartwarming to hear about the work that you're doing under incredibly challenging circumstances, and you really are an absolute lifeline for the people that you serve, and it makes me incredibly proud that the foundation is able to partner with you and to be part of your work. And so I just want to thank you so much for sharing all of that with us.